everyone, namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is powered by Apollo 24/7 where we bring you experts from Apollo hospitals to this live show and where you can interact with them. You can type your query in the chat box of YouTube channel of Apollo 24/7 and we shall take up this query, get you a live answer from our expert. Also in the show you have health quiz coming up towards the end of the show where you can participate and win prizes from Apollo 24/7. Also, we're going to give away discount vouchers and coupons. Stay tuned so that you can use them on Apollo 24/7. Download the app and get the entire benefit of Apollo Hospitals to your mobile phone. तो चलिए आज का टॉपिक है heart problems in old age. As we age, our heart might also age. So what are the problems that one can find in their senior years and how can we help them with heart problems? Today we have an expert cardiologist joining us, Dr. Gautam Naik, with more than 12 years of experience. He is the cardiologist at Indraprastha Apollo Hospitals, New Delhi, and he can be consulted for heart transplantations, TAVI, TAVR, primary pulmonary hypertension, acute pericarditis, atrial tachycardia, aortic interventions like TAVR, EVAR and COA, etc. and as well as pediatric cardiac services. काफ़ी सारे professional memberships है sir के. So he's recently come back from the UK. He's been an while European Society of Cardiology के भी professional member है, British Association of Cardiologists of Indian origin के भी member है. So let me welcome Dr. Gautam Naik. Very good morning, sir. We can't hear you well, so if you have turned your mic off.
Yeah, sorry, my bad. Thank you,
yes,
madam. Yes, and thank you to all Apollo 24/7 platform and my namaskar to all the viewers today. Thank you for having me.
Thank you so much for joining us on this Sunday morning. As I'm seeing that the Heart Valve Society Council on Valvular Medicine, that's you're a member in that as well. So all the valvular diseases, they come into a special branches. What are our, let me understand, what can be the heart diseases like, especially in progression of age?
Yes, so thank you for that question. Essentially, heart disease is a very broad term, which includes a lot of preventable heart problems and problems which are related. So heart disease by itself may include coronary artery disease, which is essentially blockage in the pipes that supply blood to your heart. So we all know that the heart is a pump. It's a magnificent pump in that it pumps blood day in and day out and helps us survive, providing blood to all the organs of the body. Coronary artery disease, which is the most common type of heart disease, and obviously is a lifestyle disease which can be prevented in some cases. It originates from blockages, more predominantly from blockages that supply blood to your heart. So that is what is coronary artery disease. A severe form of coronary artery disease would be categorized as a heart attack in common parlance. It is also called as an acute coronary syndrome. So a severe form of coronary artery disease, which tends to happen in old age, but more and more we are seeing this in younger people. So that's one part of it. There are other forms of heart diseases which commonly are categorized as cardiomyopathies, which is essentially a problem in the pump of the heart. Essentially, blockages are the most common causes of problems in the pump of the heart, but there are other causes as well. Myocarditis, for example, viral myocarditis, or for that matter, COVID, which recently hit us, also can cause heart muscle problems. It's a viral disorder. So that is one of the causes which can lead eventually to heart failure. Then there is valvular heart disease, which essentially is a disease of any of the four heart valves that we have. Now, the heart valves regulate blood flow to and from the cardiac chambers and onto the great vessels. When we have problems in any of our heart valves, you must have heard of things like aortic stenosis or mitral stenosis. So essentially, there are four heart valves in the heart: aortic, tricuspid, mitral, and pulmonary. Two of them are on the right hand side and two are in the left hand side. So we have four heart chambers essentially, and any of the diseases, either narrowing of these heart valves or leakage, which is called stenosis or regurgitation in medical parlance, can cause heart failure. So that is valvular heart disease. Then we go on to arrhythmias, or we have heard of heart rhythm disorders. So the heart is a pump, but it requires an electrical signal to function.
Correct.
Because it requires an electrical signal, any problem in any of the circuits can give rise to heart failure. So you can have things like pacemakers which are put in elderly age group. That is because of what is called as conduction disturbances. When there is a hierarchy in the electrical system of the heart, there's a main pacemaker, and at various levels there are different stages which take over. Something like a conglomerate having a president, a vice president, and all the HR groups. Similarly, there is a hierarchy in how the heart pumps as an electrical signal reaches it. So that is those gamut of problems are also what is called as arrhythmias, or it constitutes a branch of cardiology called as electrophysiology. So any of these electrical problems may lead to what is called as heart failure because of arrhythmias. So that's one group of disorders. Then we have something called as pericardial diseases. So essentially, pericardium is the covering that supports the heart. So heart is like a room with many chambers, and problems in any of those can give rise to what is called as heart disease. So you must have heard of terms like pericarditis. The pericardium exists because it essentially has a lubricating fluid. Although that being said, a person in cases where there are pericardial problems can live without a pericardium, but it is essentially a covering of the heart, which is a reflection. When there is fluid buildup or inflammation, it can give rise to the capacity of the heart to relax. So the heart is a pump which not only contracts but also relaxes. So that's sorry for the comprehensive explanation, but our viewers need to know that heart disease does not only mean heart attacks; it also means a lot of gamut of other disorders, which can eventually lead to heart failure. And then there's
Absolutely,
things
very
like
clearly explained,
diseases.
doctor. Because common terms में ऐसे layman को समझने की भाषा में nobody can, take out time to explain while they're in their day-to-day practice. So this means a lot of information is spreading out into awareness is important. So thank you so much for taking time to tell us what is what. So now I think I've made my notes of what you're saying and take around the questions around these problems. So while I was asking you, because our topic today is in the senior ages, as we age, which is the most important problem that might arise of CAD से लेकर valvular या structural जो भी आपने बताया है अब तक, क्या ज्यादा दिखाई देता है?
So, because thank you for that question. So, because coronary artery disease or heart attacks are very well known, there are risk factors which are associated, and these are lifestyle disorders. So, because it's the predominant disease, let us talk about that first. And it assumes a huge chunk of the burden of heart disease, which we commonly call as what is called as atherosclerotic cardiovascular disease, which means that blockages, so the heart is not taken in isolation, it also involves all the blood vessels that the heart supplies. So blockages anywhere can lead to problems as an organ system. So if there is a blockage in the kidney vessels, it is called as renal atherosclerotic disease. If a patient has what is called a stroke in common parlance, or a brain attack,
Brain,
that is
brain,
because, because the blood vessels that supply blood to the brain are blocked over a period of time, or there is a
right,
clot which is sitting in some other artery. So the heart cannot be taken in isolation. We always talk about cardiovascular problems, and atherosclerotic cardiovascular problems, meaning heart attacks, strokes, and the like, are all lifestyle diseases. Most of them are, 80% of them are lifestyle diseases, which can be prevented by intervention at an early age. So if you have high cholesterol, if you take statins, it is not just to get your cholesterol levels within normal limits, but to also prevent future heart attacks and strokes from happening. As the blockages that happen, it is being shown that these medications tend to stabilize these plaques or buildups of fibrofatty tissue within the blood vessels of the heart. So that is
So,
one aspect of it.
sir, before you proceed, anyway, we've taken up the topic of statins. So here's a question that I find. Faisal ji, quickly, not Faisal, I think, Richard. Richard Streeter, can you please type your age as well? And all the viewers who are typing their questions, may I request you all to please type in your age, gender, and any other complications if possible. Agar hai to. Yeah. Richard Streeter, ji, any alternative to statins? I'm facing muscular pain in my legs. See, he's not given his age, gender. I'm assuming it's male, and what his cholesterol levels are and why he's taking statins. No information there, doctor. But any alternative to statins is what he's asking.
Yes. Statins in some patients have been known to cause muscle pains. Now, muscle pains need to be distinguished from, there are various types of muscle pain. So, muscle inflammation, if there is muscle damage, those are various stages of muscle pains due to statins. And statins are known to be associated with muscle pain. So, if someone has muscle pains, then there are alternatives like bempedoic acid and ezetimibe. There's a different group of drugs which the patient can then consult his doctor. There are certain tests called as creatinine phosphokinase which can be done prior to knowing whether there's actual muscle damage or it is a function of muscle fatigue associated with statin usage. So statin usage can lead to a big spectrum of muscle problems, and we need to know what the patient is suffering at what age and whether it is absolutely necessary to do without statins. So it is based on the clinical judgment of the doctor. But there are tests, there are alternative medications which can control cholesterol medications, is the short answer.
Thank you, Dr. Gautam. Today, my viewers, please excuse me. I need to wear my reading glasses on, having a slight issue of blurring of my vision. So, Ravi Singh's question is, and there are 2 or 3 questions which are similarly. Sometimes I feel pain in my left side of the chest, and my echo is normal. Angiography is also normal, and also God's will M. इनका नाम नहीं दिया है, gender and age भी नहीं दिया है. Any tips on how one can tell if chest pain is from gas or heart attack? How do we differentiate? So both of them almost similar questions.
Yes. Thank you for your question. Obviously, the biggest risk for cardiovascular disease is age. Having said that, the patient in question has already declared that he's had a normal coronary angiography, which means to say that it is likely not due to blockages within the heart. There is some nuance attached to it because blood vessels within the heart tend to have a distribution just like branches of a tree. And if the main highway, say for example the small tributary roads which go out into small villages in our country, if the main highway is clear, we can only see the main highway in an angiogram. There are some situations which is called as microvascular angina, in which there could be potentially chest pain without major blockages being seen on the coronary angiogram. Having said that, it is not a dangerous or a serious condition. It can be a nuisance to the patient, which can be treated with medications alone. If he has had an echocardiogram and which is normal, and a normal coronary angiogram, then it is very likely to rule out other causes for chest pain, because the chest wall, the skin, the muscles, the bones within, gastritis. There are various other causes of chest discomfort. If you have certain viral disorders, you can have pain in the chest dermatome. So it is not all chest pain does not originate from the heart, would be the short answer. And if he's had a normal coronary angiogram, it is very likely that the origination of chest pain must be from somewhere else. But there are certain nuances or categories, which is why he should visit his doctor for further clarification.
Right. Thank you so much. And for all the other common, people who worry that is this a heart attack or any other gastritis or any other gastric trouble, any such symptoms or anything simply to identify, differentiate?
So that depends on, again, the age, the character, and the severity of pain. If someone has severe chest discomfort, it is crucial to rule out coronary artery disease or heart attacks as the cause of the pain. That's because it's the most important kind of chest pain, which can turn very nasty if you don't pay adequate attention to it. So what I would suggest is that they go to the nearest A&E or emergency department of the hospital if they have chest pain. If it is bearable chest pain, see your cardiologist in the clinic at the earliest. Get an ECG, or your primary care physician for that matter. Sometimes in remote areas we may not find cardiologists at verbatim, in which case a general physician should get an ECG and what is called as a troponin test. It is a blood marker for cardiac muscle damage. So if those two tests in serial, at least two ECGs and two blood tests are normal, then you can safely say that this is not a heart attack and it can be evaluated at a later stage. But you need those two tests to confirm that it is not a serious problem of the heart. Although that being said, it does not rule out blockages in the heart, but at least it tells you that you have some time on your hands to do that, and it's not a heart attack.
All right. Here's an interesting question, Doctor. Varadarajan Shivashankaran, who's 50 plus, he's asking this question. Hello, Doctor. Is it safe to hit 100% heart rate given the formula 220 minus the age? If we hit that rate, how long can how long can we safely sustain that without damaging the heart?
So thank you. That's actually a brilliant question and very intelligent question. So I would like to congratulate the questioner for this. Having said that, it's perfectly normal to have heart rates which are in the range of 120% as well. We see that on a routine on a treadmill. So the heart rate per se, although there is a rough formula of 220 minus age in cases where you calculate that, and these are normally in terms of the treadmill tests that we do. In context of that, we tend to take an approximation. If you reach 85% of the target heart rate, which is calculated by this formula, we tend to believe that your heart can take the stresses and rigors of everyday life, and that even if there are some minor blockages, it will not affect your way of living. You can be managed on medications and do not require further testing. Having said that, that has been recently challenged in the Western world. Where I was practicing in the UK, we used to find that treadmill tests, although they are relatively non-expensive and done with here on a regular basis, may not have a high sensitivity and specificity. These are parameters which tell you that even if there is nothing on your treadmill, doesn't mean that you don't have blockages, and vice versa. Even if you find, but if you do find, so there are 25 to 30% of patients who may have an absolutely normal treadmill, and we see that in parlance. There are only two medical ways of knowing whether there is coronary artery blockages, and those are two anatomic tests which give a relatively high sensitivity and specificity, which is the CT coronary angiography. You must have heard of people undergoing that test. And that gives you, if that is absolutely normal, there's more than 95% chance that you do not have significant coronary artery disease obstructing. And obviously the coronary angiogram that is done invasively, those are the only two tests which can tell you by and large if you have a major blockage or not. Coming back to his question, it is absolutely fine to go beyond 100 or 110. Very good athletes tend to do that on a regular basis. So 100% heart rate achieved is not a reason for you to stop.
Wonderful, Doctor. Thank you so much for answering that. So that was Mr. Varatharajan Shivashankaran's question. Next question is from Mr. Faisal Syed. I have SVT, and since the last few days I'm having fast beats and blurry vision. 54-year-old male. What is SVT, Doctor?
So SVT, as we alluded to arrhythmias, is supraventricular tachycardia, which means to say, as I spoke about the hierarchy, the of the president and then the vice president and so on and so forth.
Yeah.
These tend to originate in the upper chambers of the heart called the atria. So supraventricular means above the level of the ventricle, which is the main pump of the heart. There's a big gatekeeper called the atrioventricular node, which prevents harmful impulses from going down. So there's a big gatekeeper there electrically, which is second in command. The vice president is very powerful, or it can be looked upon like a gatekeeper which will prevent inadequate impulses from going down and affecting the main pump of the heart, because the main pump of the heart is the one that supplies blood to the rest of the body. So supraventricular tachycardias are annoying. They can cause a lot of symptoms like palpitations, dizziness, blurring of vision. You should see your doctor for medications that can control the heart rate better. And also, there are now ablative techniques which can be used in the cath lab. If medications do not work, the first stage is always to treat them with medications. If medications do not work, then in the cath lab we can try and isolate them electrically and try and ablate what is called as the supraventricular tachycardia, provided we can know. So there are different types of supraventricular tachycardias, which I will not go into the details of because of the lack of time. Having said that, if that is what he is suffering from, then he should see his cardiologist and get an ECG at the time of the supraventricular tachycardia, and also get a Holter monitoring, which is just like a video recording of your ECG for a longer duration of time. Sometimes these supraventricular tachycardias are difficult to catch by, but if he has been diagnosed with supraventricular tachycardia, that means that he has had we can assume that he has had an ECG which shows a supraventricular tachycardia. So
So,
medications first. Second treatment would be catheter-based ablation.
catheter based. Okay. So when does one
Yeah.
progress then there?
It is not an emergency procedure. First of all, this thing will not kill anyone. It will be a nuisance. It will be symptomatic. So the step one is to not panic. That's the number one thing that anyone with a supraventricular tachycardia, because it is not something which is serious enough to affect life or survival. That's number one. Number two is, yes, that's
Yeah.
reassuring for the
That is a
patient.
great reassurance. Thank you so much. Yeah.
So then the second thing is he can take medications which can lower the or control the heart rate better, which gives the frequency or decreases the frequency of such episodes. Someone who's having it for months together or having it every other day will start having it once in a month or once in a week, or the frequency will decrease.
Frequency comes
Then
down.
the duration can also, yeah. So when the heart rate is controlled, the frequency of these things happening with medications can come down. Even on medications, there is a small percentage of patients, you can say about 20%, who don't feel well even on this and say, well, I just want to get rid of this problem. If we can isolate the problem, or if we can diagnose the problem, it is called electrophysiology study with RF ablation of SVT. Then it's a curative technique. If we are able to find it, then we can ablate it using certain catheters giving some cold or microwave energies, and we can isolate it. We have an electroanatomic map, and these things can be cured but it is only meant for patients who are not who are still symptomatic on medication. So it's step 2, not step 1.
सो फैजल जी, डरिएगा नहीं, काफ़ी नॉर्मल है एंड आपका मॉनिटर भी किया जा सकता है. दैट्स अ गुड एश्योरेंस देयर. Next question is from Mr. Krishnan Sampath, 58-year-old male, recently has underwent RFA, and post RFA, I do pick up cold and cough. I still continue to get palpitations. Kindly advise.
Yeah. So the again, let me put that as a caveat further to the last question. So RF ablation we need to know what was the substrate of the ablation and what was the cause for which, whether RF ablations are even done for ventricular tachycardias nowadays. So the reason why the RF ablation was done and what was the heart structure and function also determines the long term success of these procedures. In
Right.
the young
So,
age, yeah,
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 Sampath ji, अगर आप if you want to type, please go ahead and type something. That will help us. I'm asking the
yeah.
viewer to type down further.
Yeah.
Yeah.
So, if he is having palpitations again, there has to be a holter and a documentation of whether it's a failed ablation, and we shouldn't jump on to conclusions, because palpitation is a sensation which has physical, emotional, and psychological connotations as well. The patient can have palpitations with a completely normal heart rhythm. So let me reiterate, it's just an abnormal awareness of one's own heart beating, which means to say we need an ECG documentation to say that the ablation has actually failed and what are the options that we have now. Without knowing that, it is wrong to cast aspersions on any cardiologist's procedure.
Yeah. Right. So I'm still waiting on Mr. Krishnan Sampath's response, but I don't think I have it here. So anyway, we're talking about multiple things about heart. Let me talk about Nitin's question: how to improve EF, and also is air travel risky for lower people with lower EF? There again, I don't have Nitin's age or gender. I'm just giving you the question there as a random question.
Yeah, thank you for that question. Um, I'll answer the second question first. In that, if is it safe to travel? It's absolutely safe to travel if you're on the right medications. So that
Okay.
answer the second one first, and then what are the medications to improve your EF? So whatever studies have been done on whatever medications, whatever randomized control data that we have, is not in the context of improving EF. So that was not the target of the study, but it has been found as an alternate added advantage of certain medications. Whether an EF can be improved, EF for the common viewers is the ejection fraction, which is the amount of blood that comes out when the heart pumps each time. It is ejection fraction because it is only a fraction of the amount of blood that comes out. The fraction is normally 55 to 60%. So the heart does not empty as a pump all of the blood that comes into it, because it needs some blood which is left back as preload, because the heart's pumping is contracting and relaxing. So for the relaxation function, it has to have some blood within it for the next cardiac cycle. So 55 to 60% is a normal ejection fraction. If it can go from various degrees of what is now termed as medium range ejection fraction or low ejection fraction, where it goes from, let's say, 40 to 50, less than 40, 30 to 40. There are some patients with EF less than 30% as well. So this is progressive decrease in ejection fraction. Ejection fraction is considered by many as the primary determinant of how well you go in your heart failure journey, which is true to some extent, but it is not the sole measure by which we test. There are multiple other measurements which can be used to attain heart function. But coming back to the question whether it can improve or not, that is a speculative question. It has to be done, regular echocardiograms have to be done to document whether there is an actual EF improvement. And what was the cause of the reduction in the EF will largely determine whether it improves or not, and the kind of medications that you are. So it's a very broad question which is very difficult to answer straight away. But these are some of the salient points. So what causes your decrease in EF will determine how much it will improve. What medications the patient is on may also determine how it will improve. So those are the two short answers.
No, those are very, very important short answers, because you keep a tab on the conditions that led to you, as well as keep a monitor on what's the progress, and which is very, very
Yes.
important once you are declared with a low ejection fraction. So, what are the tests that one has to continue? Agar EF
So
may fraction.
So EF is generally diagnosed by an echocardiogram, which is a very commonly available test these
ECG.
days. An echocardiogram, no, that is an electrocardiogram. An
Oh,
ECG,
so
what we call
ECG is an electrocard.
so
Okay.
that looks
Yeah.
at the heart
So
rhythm.
echocardiogram
This
is a different.
is an ultrasound of the heart. Just like you do an ultrasound for your tummy, you can do an ultrasound for your chest. An ultrasound of the chest is what is called as echocardiogram. It's given a special terminology. So, echocardiogram tells you what the structure and the function and the pumping capacity of your heart is, whether there are any structural problems within your heart which require attention and close follow up. All that is determined by the echocardiogram.
So forgive my naive question, is it called the 2D echo or is it the same or a different
Yes.
one?
Yes. So if you see the heart in two dimensions, it is called a 2D echo, which is normally done everywhere. Where there is something called as 3D echo, obviously because there is a 2D echo, but those are usually used in very select kind of procedures in common parlance.
All right. Right. So next question that I want to take up is Prakash Anand's question. How much can hypothyroidism affect heart since I'm taking Methimess since last 5 years? And also there was a registered user's question who wanted to ask about non-alcoholic fatty liver disease and the link to heart diseases.
Okay. So those are very good questions, and thanks for that. So coming to hypothyroidism by itself, in very rare cases, can cause what is called as cardiomyopathy. More commonly, what it does is it increases your blood pressure. It increases your diastolic blood pressure. So the thyroid function, if it is hyperthyroid, this patient is hypothyroid. I do realize that.
Yes. Yes.
In hyperthyroidism, what happens is the heart rate can become irregular. What is called as atrial fibrillation can happen, and that can in turn affect how the heart pumps. In hypothyroid patients, good correction of thyroid medications, if the patient is has thyroid levels have normalized, he doesn't need to worry about impact on the heart. But untreated hypothyroidism can give rise to what is called as increased diastolic hypertension. So it has effects on blood pressure which can indirectly affect the heart in the long term.
Right. So there is a link there. Just keep a
Yes.
so see that your thyroid TSH is in
Level.
normal range all the time. Yeah. All right.
And the
So
second
here's
one is
Anand Sharma.
uh,
Please continue, sir.
non-alcoholic
Oh, the
fatty.
non-alcoholic liver, fatty liver. Yes, yes, yes.
So, non-alcoholic fatty liver disease is a gamut of disorders which falls in the category of insulin resistance syndromes, which is closely linked with diabetes. A person who has found to have what is called as non-alcoholic fatty liver disease, which is becoming very common, but the most and the predominant cause in our country, more than 75 to 80% would be insulin resistance, which means the insulin receptors or the liver receptors are not able to utilize insulin, which could be in a pre-diabetic patient or someone in diabetes. India is the diabetic capital of the world, unfortunately. But yes, and such a person should also concentrate on what the diet is, what the exercise measures are. Sometimes we have seen fatty liver patients reverse their fatty livers in subsequent ultrasounds by doing lots of exercise. So hit the gym, uh, look at what you eat very carefully, cut down on carbs if possible and fatty food, and you should be okay. Because non-alcoholic fatty liver can progress to what is called as NASH or non-alcoholic steatohepatitis, and then it can lead to liver cirrhosis and fibrosis and failing liver in late stages. So it's very common. It is one of the most common things that we see in regular practice, but it can be controlled with good diet and good exercise and watching your sugars.
Yes. Thank you, doctor. Next question, two questions in line. I would ask Anand Shamana's question first. Report on TMT and ECG are normal, but echo report says LVDD and mild concentric LVH. He's 57-year-old male. Any advice for him?
Yeah, so concentric left ventricular hypertrophy is a fancy way of saying that your heart muscle has thickened. A thickened heart muscle, the most common cause of thickened heart muscle is hypertension in our country. So, closely monitor your blood pressure at regular intervals. If you have a family history of high blood pressure, which is another common cause why people get hypertension, then that person, if your parents are suffering from hypertension, then you should be closely monitoring what you take as salt intake. Concentric hypertrophy can be also because of other cardiomyopathies, which then in turn affect the relaxation function of the heart, or what is called as the diastolic function. So you've heard of systolic and diastolic blood pressure. The heart has to relax for the next cardiac cycle to begin. It has to have some preload, what is called in common parlance. If the heart cannot relax, it can lead to problems of shortness of breath. It's a gamut of disorders called as heart failure with preserved ejection fraction, the most common cause of which is hypertension. So, such a patient should keep a close eye on his blood pressure, especially if he has a family history of high blood pressure. So, that's that.
Wonderful, doctor. Next question is from Mr. Tejesh. How long should I take tablet Ticagrelor after angioplasty? यहाँ पर भी मुझे age and other issues नहीं दिया गया है.
Yeah. So how? Yeah, that's a big debate in the realms of interventional cardiology. But we have enough and more data because as interventional cardiologists, people tend to think of us as people who only put in stents. There's lots of other things that an interventional cardiologist does. But coming back to the question, if he has had a stent, the ideal answer would be as long as possible unless the patient has an increased bleeding risk. Over a period of time, the dose of ticagrelor can be reduced, but there are latest studies. So unless I know uh, how much extent of disease there is, how many stents have been put in, how long was the disease, so it depends on certain parameters. Again, it's a nuanced answer, and one size does not fit all. Just like you take a trouser from the clothing store and just put it on, it might not fit everyone. So you have to have a tailored approach when you go and treat someone. So unless I have background knowledge about what the amount of stent was, what the extent of coronary artery disease was, it is very difficult to answer how long ticagrelor should be continued. But it is safe to assume that if the patient is not suffering from any bleeding disorders, is not having bleeding either through the nose, mouth, or the back passage, then I think it is reasonable to continue ticagrelor in conjunction with your cardiologist for at least a year. Is what after a stent. If the question is just after a stent, what is mandatory, then it is 1 year as things stand right now. Not judging what, no, not knowing what the content of the stent was, what the extent of disease was. So there are lots of variables which I do not know about this patient, but 12 months is what is minimum, is
Right.
safely
That's the
minimum.
reason why I request all my viewers to give me as much as data possible in one go, so that I can place it before the expert. अगर अभी से कोई type करने वाले हैं, we request you to put in almost all details in one question. Do not break it into multiple pieces. It will be helpful for both expert and me to read it out to him. All right. So next question is about the expertise that you come from. Valvular valve replacement के बारे में पूछ रहे हैं. नरेश कुमार, 76-year-old male, 7 years of valve replacement हो चुका है. Do I need to replace the valve or go for a pacemaker if I feel weak and breathlessness?
Okay, as thank you for that question. 7 years of valve replacement. So valves come in two different shapes and sizes. If it is a metallic heart valve, it generally lasts for the duration of the patient lifelong. So I would assume that he is talking about a bioprosthetic heart valve or non-mechanical heart valve. In that context, again, it is your echocardiography which will determine. Normally, what tends to happen in the natural course of a bioprosthetic heart valve is that they will degenerate because they are made from bioprosthetic material. So, whatever nature has given us, it cannot be of the same
Yeah,
standard, because that valve has lasted him for 70 years now. He's had an operation at around 70 years of age. So whatever we do apart from that via engineering is the next best thing, which is what a bioprosthetic valve will. 50% of them will degenerate at 10 years of their shelf life. That's the reality of the engineering that we have. Now they are coming up with more and more different materials as medical science advances. We do have data coming in that there are some bioprosthetic valves which last longer, but that and the pacemaker are two different things. So we are comparing apples with oranges. We need to know the heart rhythm for the pacemaker. If he is feeling weak, there's a set of tests that we have to do to know which is the cause of the problem, whether it's the valve itself which is the cause of the problem, or whether it's the electrical problem of the heart which is the cause of the problem that the patient is suffering from. When we know what is the cause of the problem, then we can suggest what would be the right thing. So see your cardiologist, get yourself tested, and relay your reports either online, where we are all available, or whether you can see your personal private cardiologist. That would be a good idea.
Wonderful. Apollo 24/7 is always there to pitch in the gap between the distance. You can always consult Dr. Gautam Naik. Though you are in the southernmost, Dr. Gautam Naik sits in Delhi, you can still consult him on Apollo 24/7. The link to consult Dr. Gautam Naik will be left in the chat box as well. Well, the next question is Venkat Tyagarajan. Sorry, Gautam
Sorry,
ji, boliye.
I would like to take this opportunity to congratulate Apollo for taking this initiative for the general population, so that be it any part of the country, the patient now has the advantage. It's very difficult we don't realize it because we take it for granted, but in the Western world, it's very difficult to find a doctor at the click of a
An
button.
answer.
So
You don't even know where to go. In fact, this program, to my viewers who must have joined us now, was started in the darkness of the pandemic, where we were all searching for information. That's when Apollo Hospitals decided that they will bring their experts onto this platform to share information on pandemic COVID. But then we branched out since then to reach out. Faisal ji, you had answered Faisal's question earlier. So Mr. Faisal is profusely thanking you for the reassurance. It is really wonderful to be a platform to be able to reach out to people and help others. Wonderful. Yeah. So next question of Mr. Venkat Tyagarajan. I've undergone angioplasty on October 2019. Since then, I'm taking Viomeda 100 mg twice a day. 64-year-old male. I get an echo done. Right now, my EV is 50. Should I get an echo done every 3 months?
Well, again, as I said, Vimada has come up in the last 10 years or so as a wonder drug. So the ejection fraction is but only a part of your heart health, though it's an important part which, as I said, cardiologists take to make decisions. If your ejection fraction is in the range of 50%, I think what would then be recommended is a 6-month to an yearly echo should be fair enough. Do not feel the need that every 3 months you should have. Every 3 months, definitely not. But I don't know when your last follow up was, and those questions again are unanswered for me. But as a common thing, I would tell my patients, if they are having a normal ejection fraction, to repeat it in 6 months' time.
6 months should be good. All right. So Gautam Chatterjee ji ka question hai. I'm 65-year-old male. I've undergone angiography in 2018 with 30 to 40% of eccentric plaque in LAD. Then the doctor suggested thallium scan after 5 years. Is it useful to know the progress?
So that's again a nuanced question. If the patient is on optimal medical therapy and there is no symptom which brought him to the cath lab in the first place in 2019, and he is completely asymptomatic, then any knowledge is good knowledge, but if you do develop symptoms, then all of these are adjunct tests. So the question essentially, what I understand is he's having stable non-obstructive coronary artery disease as diagnosed in 2019. Now he does not have any symptoms and is on medical therapy, I would assume, because he's not said that I have chest pain and I'm doing these tests. So what I advise my patients is, the patient will guide the therapy. How he feels at that point in time will determine what tests need to be done in a stable situation. In an unstable situation, having said that, you can always have a heart attack, and that is not any doctor's fault or the patient's fault by himself, unless the patient is not taking his medications diligently as prescribed by his doctor. So in an ideal environment, a thallium stress test does tell us, it's a nuclear medicine test which tells us as to how much of the heart is affected by lack of blood supply. If he had a 30 to 40% eccentric plaque, it depends on how his risk factors are, how he's taking his medications, whether he has any symptoms or not. So the symptoms will dictate whether what testing needs to be done.
Right.
If he doesn't have
So next,
symptoms, then no
sorry,
test will
sir.
not help him. Sorry.
Yeah.
So if he does not have symptoms, then I wouldn't recommend any testing.
Yeah. Because I have last 5 to 8 minutes left, I would want to take up as many questions as possible. And I will take questions which are of importance in order, sir. So I hope my participants don't mind. Mayank Dobrial, father is 63-year-old, has undergone 2 stent placements in 2011. And now last year we came to know that one of his 4 chambers are not working in sync with the others. So what can, it was 15% last year and is now 32% in 1 year only with medicines. Doctor suggested CRTD as an ultimate solution, for which my father is not willing. Any other suggestions? Only with medicines.
Well, if he has been suggested CRTD, now let me tell the viewers what a CRTD is. Essentially, it is what is called as cardiac resynchronization therapy with a defibrillator rather, as the D. So you must have seen external defibrillators at airports, at markets, at malls, which give a shock and then improve the functioning of the heart. What I can assume from this gentleman is, if he has been suggested that, then his heart is very weak, his conduction is not in synchrony. That is when a CRTD is prescribed to a patient. If he is symptomatic despite optimal medical therapy, then in that case, a CRTD needs to be done. So that is something I would say a yes rather than a no for him. The short answer would be, whether he is willing or not, that is a call that the patient and his family should be taking. But as a doctor, if a CRTD has been prescribed, then he should undergo CRTD.
Right. So please do explain your father, because he's not very old as well. I think it'll bring a lot of change when information is being given to him. Assurance comes from information. So don't do let him listen to this. The recording will be left after the live show. Please make him watch what Dr. Gautam Naik has given him as a suggestion as well. All right. So a lot of questions regarding which are not about old age. So I'm not taking them up, but. Yes, this is not just for older people, this is for younger people. Our patients have been thanking you for such wonderful. So, one quick question, doctor. How do we understand if I have, okay, registered users question, why do men have a higher rate of heart attacks than women? Actually, does gender play a role?
Well, so there's two schools of thought in this. A is that what was believed. What tends to happen is because, and this is a tongue-in-cheek comment, because of the quote-unquote patriarchal society that we have, women have been generally underdiagnosed with heart disease. Now, in the Western world, as in India, there is an awareness towards women's health, especially women's heart health, which I am very much an advocate for. So, with that caveat out of the way, physiologically, there have been in the Western world, and because most of this data has come from there, the estrogen was believed to have a cardioprotective role until the lady attains menopause. And post-menopausal studies have shown that the risk is almost as good in men as well as women. So being a male itself is a risk factor for heart disease, but it is not an excuse not to diet, not to exercise, not to follow a lifestyle which is good, because heart disease tends to affect men and women equally. So
Right. Last,
that's where I stand.
yeah. Last two questions. Nutan Kumar Naranji and Prashant Patnagar, one after one. Nutan Kumar, can 2-3 years of taking cholesterol and triglycerides medicine cause liver or kidney damage?
Well, that depends on how your liver function behaves after taking those medications. So that's an answer which is, speculative. We need to know what the results are, so you can test your liver and kidneys at regular intervals to see if your medications are having any effect at all or not.
Oh, yeah. Prashant Patnagar ji ka question, if lipid profile is normal, doesn't mean that your heart is functioning well and there is no blockage. Male, 45-year-old.
So, um, so yeah, normal cholesterol level absolutely does not mean that there is no blockage, because the process of blockage is a normal process which, to our surprise, starts at 18 years of age. This plaque keeps on building, so age is a cardiovascular risk factor. So the answer to the question is, whether a significant blockage is there or not should be the question. So a reformed question, whether there is significant blockage or not. If you take your cholesterol medications regularly, it stabilizes the plaque. It does not make it an irritated, angry plaque which may lead to blockages within your heart. So the reason for taking cholesterol medications, even if your cholesterol levels are within normal limits, is to prevent further downstream problems, because it also has what is called as a pleiotropic effect, which is stabilizing the heart plaque in normal terms.
Right. So thank you so much, Doctor. With that, I think I've come to the end of the questions from our viewers, and we shall end the session with, yes, Doctor. We are yet to end the session. Yeah.
Yes,
Please continue.
Jhansi ma'am, I wanted to thank you first for your professionalism, despite not being so well. Just before the meeting, we did have a discussion, and I would like to salute your professionalism in all of this. That despite drinking sips of water, you've made it. Your voice was not great, but you helped us out throughout the thing, and you've been there to support the program and help the viewers. So, thank you.
Appreciate it. Thank you so much. So as we wind up, now I would want to throw light on the scare that people have towards procedures, especially something with heart and procedure. You're all mostly scared. So how do you want to remove that fear and anxiety before a surgery, and especially you being a valvular specialist, how do you address this, doctors?
Yes, so thank you for that question. When it comes to, so again, it's a nuanced answer. First is transparency and honesty between the patient and the doctor. It's a sacrosanct relationship, is what we believe. I mean, there are various factors that come into it, some patient driven, some doctor driven. So, without getting into it, you have to be as honest and as persuasive. Honesty is the best policy. So I tell all my patients the risks associated with doing certain procedures. But when they turn around to me and say, "But it's an invasive procedure, what do I do then?" I tell them that, statistically, flying in a plane is a risk. There is a 1 in a 1 lakh chance that something may go wrong. If you cross the road in India, it is not certain that you will reach the other end of the road without getting hit by a vehicle.
It's
So yeah, within the limits of, so again, that's a statistical risk. Similarly, the benefits of doing this particular procedure, a particular procedure, have to far outweigh the small risk that is associated with intervening into someone. With any intervention, whether it's transcatheter based or surgically based, has some risk attached to it, but the doctor wouldn't advise you certain procedures where the benefit of doing the procedure would far outweigh the risks. And that is something that our viewers need to understand, that any doctor in his right mind would always prescribe uh, any test or any investigation, even if it's invasive, only if he feels at that point in time that the benefits of doing it would far outweigh the risks.
Yes, we understand that the fear is common, but when you have information enough, then you will overcome your fear and you will be guided well. Thank you, Dr. Gautam. Before you take leave, we want you to give us top tips to take care of heart in the old age.
Yes, thank you. So the top tips would be: one, monitor your diet. Number two, regular physical activity, at least 45 minutes a day for at least 5 days a week. Number three, monitor your sugar levels. Number four, monitor your cholesterol levels. Number five, monitor your blood pressure. And number six, stop any addictions like smoking, alcohol, and you should have a healthy heart and a healthy life. Thank you.
Very simply put, but effective answers there. Thank you so much. So, as we take leave from Dr. Gautam Naik, we would want to announce that we have a health quiz coming up, requesting all the viewers to Dr. Saab ko maine thank you bola hi nahi, but anyway, thank you so much, Dr. Gautam Naik ji. Yeah, thank you so much for being with us on this platform on this Sunday morning. Yeah, thank you. Yeah, and I continue doing my health quiz now. I'll take leave from you. You have to answer these questions on YouTube chat. Winner's name will be announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. Winners, if I'm taking your name to be the winner of this week, you have to write back to us at marketing@apollo247.com with all your contact details. That is marketing@apollo247.com. Gift vouchers will be shared with you. इस हफ्ते के 3 questions हैं on the screen. Fill in the blanks. Your heart has dash chambers. Your heart has dash chambers. Fill in the blank. Question number 2. True or false में answer कीजिए. The human heart is about the size of a human fist. Human heart is about the size of a human fist. True or false? Question number 3. Yes or no में answer कीजिए. Structural heart disease refers to conditions that can affect your heart's valves, walls, chambers, or muscles. I repeat the question. Structural heart disease refers to the heart's valves, walls, chambers, or muscles. Yes or no? These are the 3 questions for today. Let me see. A lot of them are answering. Dhanlakshmi, Anmol Ratan, Simran, Ravindranath, JS. Yes, a lot of you are answering. In the meanwhile, while answers come in, let me give you coupons that you can use on Apollo 24/7. The first one is AskDoc150. Use the code on Apollo 24/7 to consult top doctors to get 150 rupees cash back on online doctor consultation. The next one that we are giving away to you is First 3, FIRST 3. This is to order medicines direct from Apollo. You get 25% off on online medicine orders as well. The next one is exclusively for our Health Hour viewers. Use HH247 to get 199 off on online consultation and 20% off on medicine orders as well. And now you can get WhatsApp. You can just text or call on WhatsApp to book medicines or book lab tests. It's 09355247247 to avail healthcare services on WhatsApp of Apollo 24/7. So chaliye, let's keep an eye on what's happening at our let's see who's all participating. Okay, not many, but please do continue if you can type in. Let's see who can be our winner today. Next week, we are going to talk about an interesting topic: mom and baby care. You know, a newborn and a mother, new mother and a new baby care. Everything that you need to know. We are going to talk about it on June 2nd, 11 a.m. 2nd of June, 11 a.m. We're going to talk about it. So let's see who our winners are. I'm waiting for the team to see who the winners are. The winners are Surinder Jandial, Dhanlakshmi and Aman. Surinder Jandial, Dhanlakshmi and Aman. Please write back to us with your contact details at marketing@apollo247.com. Then your gift vouchers will be shared with you. Thank you all. It was wonderful indeed having you and Dr. Gautam Naik on the show. Thank you once again.